Mr. Green.
Hi.
Hi, I'm Corey. I'm a nurse practitioner student with Youngstown State University. I'll be seeing you for your appointment today.
Thank you.
I just need to verify some information with you. Can you tell me your full name and date of birth?
Stephen Dallas Green, 11380.
Okay. How would you like me to address you today?
Dallas is fine.
Dallas. So what brings you in today?
Just a checkup.
Okay. Overall, how are you feeling?
Okay. I mean, feel alright for what it is on a daily basis
Okay.
as a 43-year-old man.
Is there anything health-wise that's concerning to you?
Not necessarily, no.
Okay. So we're going to start off today just doing a health history interview. So I'm just going to be going over a bunch of questions. I'm going to start with your family history, so going over your parents and sibling and grandparents. Are either or both of your parents living?
Yes, they are both living.
Okay, so starting with your mom, how old is she?
69.
Any health problems that you know of with her?
She has arthritis and I don't know, a lot of just constant pain. She's had hip replacements.
So both hips done?
Yes, both of the hips have been done within the last couple of years.
How about with your dad? How old is he?
He's 70. He has high blood pressure. He has this cardiac issues on his side of the family also.
Okay. Does he have cardiac issues, or is it with his more his parents?
Just he has high blood pressure. I mean, he takes medication for it. So,
Okay.
but the cardiac issues is with his dad and his grandma or his mom, I should say.
Okay. Do you have any siblings?
Yes, I have a sister. She's 3.5 years older than me.
Okay. So around 45?
Mm-hmm.
Okay. Any health issues with her that you're aware of?
Not that I really know of, no.
Okay. What about your grandparents? Are any of them still around?
No, they're all gone.
Okay, so starting with your mom's parents, do you know what your grandfather passed from?
He had, pretty sure he had some congestive heart failure at the end of his life. He also had lung cancer.
Okay.
I think he had diabetes also, but.
Okay, what about your grandmother on your mom's side?
My grandma on my mom's side, she had Parkinson's and dementia. I also had some cardiac issues also. She had a quadruple bypass done at one point in time.
Okay. On your dad's side, do you know what your grandfather passed from?
He died of a heart attack in his, I think it's in his late 60s, I'd say.
Okay. Any other health history of him that you're aware of?
No, not that I know offhand.
Okay. What about your grandmother on your dad's side?
She also had Parkinson's disease and dementia, and I think she might have had congestive heart failure also.
Okay. All right, so kind of focusing on you. Are you married? Are you single?
Married.
Any children?
2
How old are-
boys, 7 and 4.
Okay. What's your highest level of education?
I have an associate's degree.
Are you currently employed?
Yes.
Where do you work at?
Select specialty hospital / medical company, I guess you could call it.
Okay. And what do you do there?
I'm a PTA, physical therapist assistant.
Oh, okay. Do you work full-time, part-time?
Full-time,
Do you have
Monday
how
to
many,
Friday.
about how many hours a week do you work?
40 hours, yeah, I mean
40?
32 to 40 hours.
Okay. Any allergies to medication or food?
I'm allergic to erythromycin, Advil, and I think I have a sensitivity to like shrimp, but other shellfish I really don't have any issue with. So.
Okay. What kind of reaction did you have to the erythromycin?
I had severe stomach cramps and dry heaving.
Okay. What about to the Advil?
I had hives with the Advil.
Okay. Do you remember what type of reaction you had to the shrimp?
Just some digestive issues. I had a lot of diarrhea, or
Okay.
severe diarrhea, I should say, after I last ate it. So.
medications that you're on now?
I take a Protonics.
Do you know how much you take a day?
I think it's 40 milligrams a day,
Okay.
and I take a multivitamin.
What are you on the Protonics for?
What is it, like GERD?
Okay. You have some acid reflux?
Acid reflux, yeah,
Okay.
sorry. I guess that's the better
No, it's
definition
fine
for it.
either way. Do you feel like the Protonics, do you feel like that helps, it manages your symptoms?
Yeah, it's kept me under control
Okay.
pretty well.
Are you up to date on vaccines?
Yeah, I mean, I've had my COVID vaccine, the 2-stage shot. I haven't had any of the booster shots. But
Okay. Did you get a flu vaccine this year?
no, I did not.
Okay. Any past surgeries?
Oh yeah, I mean, had my wisdom teeth taken out when I was a child, and then my tonsils taken out when I was a child
Okay.
or teenager, whatever.
Anything else?
Not that I can remember. Oh, as an adult, I do remember now. I had a mastectomy.
Okay. Do you remember when that was?
4 years ago, 3 years ago, 3 years ago maybe.
Okay. Do you remember the doctor
kinda-
that did it?
Oh gosh, no.
Okay.
I'm not good with those names.
That's alright.
It was at Mercy Hospital, that's all I know.
Okay. So probably urology at Mercy?
Yes.
Okay. Do you drink caffeine?
I have a cup of coffee a day
Okay.
in the morning.
Do you drink alcohol?
Yeah, probably about 12 beers a week, I'd say, on
Okay.
average.
Do you smoke?
Yeah, I smoke those Black and Mild cigars, like,
Okay.
I don't know, maybe 2 a day.
Any illicit drug use?
No.
Do you exercise?
Yeah, I go in spurts, like, I don't know, every 3 months or so I do some weight training. We call it HIIT training, high impact, what is it called? Shoot. High intense training, whatever it's called,
Okay.
which adds aerobic exercise as well as, body training exercise, that type of stuff. So,
Okay. So it kind of covers cardiac and weight training.
yeah.
Okay. So I'm just kind of going to go over a review of symptoms, or review of systems, I'm sorry. So I'm just going to go over a bunch of things and just let me know if it's anything that you have any problems with. So any fevers, fatigue, if you notice any weight changes?
I mean, only when I'm dieting, I would say nothing, unplanned, no unplanned weight loss.
Okay. Any headaches?
No, nothing to complain about.
Alright. Any issues, difficulty swallowing?
No,
Any issues with your teeth?
no.
Any vision or hearing changes?
I mean, I don't know. It maybe just stuff that comes with age. I can start to notice maybe it's fine print getting a little bit smaller, but nothing to complain about.
Okay. Do you get yearly eye exams?
No, probably should, but I don't.
Do you feel like that vision's getting worse?
I mean, not drastically, but yeah, it's progressively.
Okay. Do you feel like you need possibly glasses to help you, or is it not that bad yet?
It's not that bad yet, no.
Okay. Any issues with your nose, nasal congestion, stuffiness?
I don't know. In the winter time, I get a little more stuffy, but I mean, it just by blowing my nose, I clear it. It's nothing major.
Okay. Any issues with shortness of breath?
No.
Coughing?
No.
Chest tightness? Have you ever been diagnosed with asthma or any asthma-like symptoms?
No.
Any chest pain?
Nope.
Palpitations?
In the past, I've had some issues. I think it's more stress-induced, but as of recently, I haven't had any issues, no.
Okay.
I think it might have been caffeine-induced, too, at one point in time.
Do you remember the last time that you had those?
It was probably at a high capacity or a large amount. I would say it was probably about 4 years ago.
Okay, so it's been a while. Okay.
Yeah, it was diagnosed as stress. I had to monitor monitor that was put on for me for about 12 hours, and then I had an echo done, so there was nothing really
Okay.
to diagnose me with other than stress. That's what the doctor had said. So
Okay. Any swelling that you've noticed?
nope,
Okay. Any abdominal pain?
no,
Distension? Constipation or diarrhea?
no,
Notice any dark or bloody stools?
no,
Okay. And I know you said you have the reflux.
yes.
Okay. Do you take anything along with the Protonics to help? Do you have any flare-ups that you need?
Yeah, it depends on what I'm eating. I might take some Tums periodically. I do like Italian food, so usually that's what really sets me off. Or pizza.
Okay.
I don't eat it very often, but
Okay. Any difficulty with urinating?
no,
Okay. Any difficulty waking up in the middle of the night to feel like you have to urinate?
no,
Okay. Any issues getting or maintaining an erection?
no,
Okay. Have you noticed any skin discoloration?
no, nothing
Okay.
remarkable.
Any new or changing moles?
No,
Okay.
not that I've noticed.
Any rashes or itching?
No,
Any joint pain? Muscle aches?
nothing abnormal for my age, I would say.
Okay. No muscle injuries?
No,
Okay. Any history of seizures?
no,
Do you ever feel lightheaded?
no.
Any numbness or tingling?
Just if I don't sleep on my arms or have my, arms or shoulders in different positions, no, nothing remarkable.
Okay. Any issues with excessive bruising or bleeding?
Nope,
Any history of blood clots?
no,
Have you ever had a blood transfusion?
never.
Okay. Any feelings of anxiety?
In this day and age, nothing, nothing remarkable, I guess you could say. No.
Okay. Depression?
No,
Have you ever had any thoughts of suicide or harming yourself?
no.
Any difficulty sleeping?
I don't sleep that well, but I go to sleep, but I don't sleep very long, I guess you could say. So maybe on average 5-6 hours a night.
Okay. Have you ever taken anything to help you sleep?
No, I don't feel like I want to get into that world, so I'm comfortable with what I do. I don't
Okay.
have problems falling asleep. It's just I don't know. My brain turns on and I'm awake. So, but I feel like I get a good night's sleep anyway. So
Okay, so after you get up, you feel pretty well rested.
yeah. Yeah, on an average basis, yes.
Okay. How about family support at home?
That's good.
Okay. If you're ever going through hard times or stress, how do you cope?
I don't know. I try to find something to relax to, or some activity to do with my family, or I don't know, a hobby,
Okay.
golf maybe.
What brings you joy in your life?
My family, my kids, my wife. Hobbies again, fishing, golfing. I don't know. Whenever I find time to do that.
Okay.
Warm weather.
Hopefully coming soon.
Mm-hmm.
Anything in your life that you find difficult or troubling?
Oh, nothing remarkable. No, not really. No.
Okay. Is there anything else that you'd like me to know?
No. Not offhand.
Okay. Well, that's all the questions that I have for you today. It was very nice to meet you. If you need anything in the meantime, feel free to reach out to our office, and I will be seeing you soon to continue with your physical exam.
Okay, thank you.
You're welcome.
Have a good day.
Thank you.